A new study from the Pew Research Center says more adults are choosing not to have kids. The study found that the number of childless American adults younger than 50 years old actually is going up. That number went from 37% in 2018 to 47% in 2023. Researchers polled 3,300 adults who do not have kids and say that they are unlikely to have them. Among the reasons why, financial concerns and then infertility as well. And even when families do overcome obstacles to becoming pregnant, a lot of women and babies are still facing poor health outcomes, making the U.S. among the most dangerous developed nations for childbirth. Joining us to talk more about this and ways to help reduce those risks is Dr. Erin Ferrara, and I appreciate you coming in early on a weekend. Thank you so much.
Of course.
Can you walk me through these poor outcomes? What are we seeing and who is it impacting?
So the CDC actually reports that 80% of pregnancy-related deaths are preventable, which is huge. I think hypertensive disorders are among the top reasons for maternal death and poor outcomes. And there are definitely health disparities. This hugely impacts Black women. And so there are definitely things that we can be doing as providers, as communities to help improve this.
I know there's been so many task forces and stories about maternal mortality, but there's also conversations families can be having with their doctors about options to try to make that pregnancy as safe as possible. What does that look like? What questions should people be asking?
So I think it happens first in that room with the patient and the family, and finding out what risk factors they have that could put them and their baby at risk for poor outcomes. So looking at those risk factors is the starting place.
And you were also talking about low-dose aspirin in some cases. Can you talk about who that would be appropriate for and what it helps prevent?
Absolutely. So there have been huge studies on low-dose aspirin being used to prevent preeclampsia, which is a high blood pressure condition in pregnancy. And low-dose aspirin, which is 81 milligrams once a day, can be shown to help prevent it and then preventing the poor outcomes from preeclampsia. There are certain criteria that we use to figure out which patient this could be best for. The high-risk criteria, I would say, would be a mom who has had preeclampsia in a prior pregnancy, if perhaps they have high blood pressure outside of pregnancy, any history of diabetes, and any other potential risk factors. Some things like autoimmune conditions can put them at risk, things like that.
Is it safe for a woman to be taking aspirin during that pregnancy? Is there any concerns for her, concerns for the baby?
It is definitely safe. For mom, there's been no increased risk of people think about bleeding, no increased risk of that. For baby, also no increased risk of birth defects or bleeding. So definitely safe to be taking.
Yeah, and you were saying that this is being studied. Would you say it's well-researched? Is that research still in its kind of preliminary terms? How would you describe that?
It's definitely well-researched, but certainly still being studied. Kind of nuances in the dosing and are there more patients that could be qualifying for it? There are certainly some lower, we call them moderate risk factors. So if a mom is obese or advanced maternal age, 35 or older, there are some other criteria we use as well.
And before we run out of time, I just want to get to making sure that this is not something that people should just start taking on their own. They need to have a conversation with their doctor, right?
Absolutely, yes.
Yeah.
Definitely.
And figure out if this is the right decision for you or not, but it's an option for people to consider.
Exactly.
All right. Well, we appreciate you coming in. Thank you so much.
Absolutely. Thank you for having me.